Hi, and thank you for watching this video about the Relative Mobile Pain Treatment Program. And this particular video is specific to massage therapists. So I had to make a separate one because what you do is a bit different from everyone else. So one of the first things we'll talk about is the actual treatment modality called neurofunctional pain management. And we'll talk about how a massage therapist can engage in that treatment modality with their special skill set and techniques. So we call it NFPM, is neurofunctional pain management. It's a treatment program that I've put together and created back in 2018. We've been doing this around the country ever since then. It is a non-pharmaceutical, non-surgical, and non-invasive treatment modality for chronic pain. It uses a high pulse electroanalgesic therapy, and that high pulse current is actually what causes the pain relief, the primary factor of what causes pain reduction, pain relief. And there's a few different ways it does that. I could probably talk for hours about how the specific high pulse frequencies actually interact with the nerves in doing this. But I do want to point out that this is quite a bit different from the other electrical devices on the market. Most of you out there watching this have probably never seen or heard of this actual category, not just the device, but the actual category we operate with. It is called electroanalgesic therapy, and it's called a kilohertz electrical device, which is entirely different from TENS units. So the TENS units people are familiar with are low power devices designed to stimulate muscles, fatigue muscles so that they relax, right? That's what they're for. Ours is a neurostimulator. It operates entirely differently. It has a high pulse frequency of electrical current that interacts with neurons specifically, and it depolarizes pain neurons so that they don't report pain, and it also stimulates the release of neuropeptides, neurotransmitters, particularly the three that are most effective in the pain relief process are endorphins, enkephalins, and GABA. Um, Most people who are kind of in this realm of knowledge, they would tell you that those three neuropeptides or neurotransmitters are primarily the response of a runner's high. So when people are treated with this device, they are effectively achieving a type of runner's high, which it helps to overcome the chronic pain that they're suffering from. In addition to the current interfering with the conduction of pain signals. So there's a couple of things going on there, but ultimately just keep that in mind that the current will release these neuropeptides, neurotransmitters, creating this effect. All right. So in a normal neurofunctional pain management therapy, we would also have IV therapy as the second component. It's a nutritional IV therapy. Uh, Most massage therapists probably aren't going to be engaging with the IV portion, but some of you are in offices where that is possible. So to do a full NFPM program, the patient would have the electrical therapy, the IV therapy, and then also health coaching, right? So those are the three components of the actual program, right? So a lot of people ask, okay, so how does a massage therapist engage in this program and conduct treatment? So our program is a medical treatment. It's an ordered treatment. It is an 8-week program. It is consisting of 16 total treatment events, right, for chronic pain. It is covered by Medicare and commercial insurances. For Medicare, we bill Medicare directly ourselves, and we'll talk about how you, as a therapist with us, work with us for this. But for insurance reimbursement for commercial insurances, it's cash pay self bill. So we charge the patients ahead of time. They take their own claims and submit them to their insurance. This is a covered treatment, so a lot of people, the reimbursements are there. But with commercial insurance, it is the same headache everyone has getting paid, and everyone around the country hates commercial insurance, right? So that's what we see the same thing here all over the country. Some insurances are great and they'll pay it just fine. Other ones fight, 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 and do not want to pay, right? No matter how approved and covered and whatever else it is, they still don't like paying claims when the other insurances will just fine. So you never know who's got the insurance, who's going to reimburse easily or not. But that's why we do cash pay self bill, because we want to make sure that you're getting paid for the work and the time that you do, right? That you put in. Health coaching is great. We will train you on that as well. But the nurses and technicians and therapists in our program will do health coaching with each event, and that's documented in our EMR system. So at the conclusion of every treatment, you would put the notes and charting into our EHR, EMR system. We use Charm, EHR. The notes and charting are very, very quick and easy. Takes maybe a few, like three to 4 minutes to just, go through and input the basic details. Everything's preset for you, and it's pretty convenient. So we use that. Um, Now, going forward, how does this work for you as a therapist, right? And I apologize too. I've got some bright light shining in here. I hope that's not distracting. But how does this work for you as a therapist? The Using the electrical therapy, we have a technique that is called Neurassage, right? It's technically using manual application of electrical therapy. So in the world of physical medicine, this would be a manual therapy, hands-on treatment, right? Now we do that combined with electrical current. So imagine for a moment a circuit, right? And I tell people sometimes the patient's the light bulb. So I think about that. But you have a circuit, and a circuit, is one whole round. The electricity conducts through the wire or the current, whatever, and comes out the other side and goes back to the original source, and that's a circuit, right? So in our scenario, the patient is hooked up to one half of the circuit, and then you are hooked up to the other half of the circuit. Then everywhere that your hands touch the patient, you are conducting electrical current, right, directly to the patient. Now, the significance here is that you could use your actual hands, or in some scenarios, there's conductive gloves that you can wear that will also conduct the current. The actual use of a high pulse, a kilohertz frequency electrical current combined with the hands-on therapy application is something that I patented years ago. Now, that is something that I don't promote or enforce the patent pretty much around the country, but I mean it's something that I have been working with this for a long time, applied for it. Nobody else in the industry had anything like it, and it was great. But the scenarios around which we use it are basically unique to what we do. So this Neurassage technique is the application of high pulse electrical current with a hands-on delivery system. So why is that so important? In a regular treatment, you would simply apply the pads from the device onto the patient. And then you would run the machine, run the device, and it would actually, conduct the current, and it would do the thing. You're not touching the patient at all in that scenario. And it would work great. Patients get out of pain just fine. But you could do the Neurassage technique, hook the patient up to half of the circuit and you to the other half, and then you touch right where the pain is. If you have a patient with back pain, you can put your hand, finger, thumb, whatever, right into the spot where the pain is, like right into the joint, the facet joint, the area where the pain is conducted, and actually hold it there and deliver this high pulse current that's eliminating the pain. Truly, if you talk about like melting away the pain, I mean, people can feel the pain relieving almost as you are there, right? Some of the people doing this technique have pointed out that, if you're familiar with all the massage techniques like you are, you don't have to, there's not a ton of pressure needed. The current conducts a lot of energy, and the patient feels substantial responses everywhere that are touching and massaging them. You don't have to dig. You don't have to go in deep to find this. You can get right to the points of pain, hold it there. We have been doing this for years, developed a few different scenarios for how to handle all the different back pain issues and whatnot. But you'll get trained on that. You'll understand how to use it. But the significance of this is that if a patient has a chronic pain issue and they come in and they do one of these treatments with you, right, chances are very high it's going to work for them and they're going to love it, right? They're going to want this to be how they manage that pain. So you're looking at low back pain, sciatica pain, anything in the spine, joint pains. There's a variety of about 24 different types of pain that we can treat. Most common ones are neuropathy, knee pain, and back pain. All right. But you'll find that the patients with back pain and low back and sciatica, those are the patients looking for typically for massage techniques for managing those pain issues. even in the traditional massage setting, they're trying to manage those pain issues. Now imagine adding this high pulse current to it and achieving that pain relief outcome. So that's what it's doing. One thing we have noticed too is that the people that do this become very dedicated to this. This is the patients, the clientele become a very dedicated clientele. So when I tell people all the time, you can build up a very strong clientele that will be with you for years and years and years. That's a very true scenario. I mean, there's people that I know who've done this for years and have a clientele that is just so dedicated. One person I know told me that she has practically about 100 people on her wait list, meaning that if anyone were to cancel an appointment, there's 100 people who are willing to step in and take that spot. And this particular therapist has a 3 month booked out calendar, right? So she's got 3 months of future activity already booked out on the calendar, with 100 people on the wait list waiting to get in at any time. So you can see how this can become an extremely valuable aspect of your career as a massage therapist, right? Now, how does the reimbursement side of this work? You don't have to worry about it. We handle all of that. So there you go. Answer those questions. This is covered by Medicare and commercial insurance when it's engaged in as a pain treatment protocol using our model, right? So the work that you're doing would be under our medical director. So we have medical director in every state where we operate. You're operating under their direction, but the patient is also operating under orders from a provider. So we have an order form, it's a medical order form for treatment for chronic pain. Their provider or some other provider that we work with will evaluate the patient and they'll sign orders for them to move forward. You then conduct the orders. As a contracted employee of our company, you would then conduct the orders under the direction of our medical director as an independent contractor. And then we will pay you for the work that you perform. So we have a fixed fee structure rate, and you'll see that in the agreement. And you know what you're getting paid, and move on and go from there. And you'll find that a lot of people that are looking for treatment in this scenario, having it be reimbursable, it's pretty strong. Like it does create a lot of demand for people to actually want to keep going and doing this program over and over. I'll scoot over and get out of the sun here in just a moment. But you'll see people coming back over and over doing this program because it is covered. Now, when we say covered, it's an 8-week program. Um, we have an 85+% success rate at getting people out of pain. So most people are going to be successful in getting out of pain. So 8 weeks. Our our duration time is typically 3 to 6 months. So people do the 8-week program, get out of pain for 3 to 6 months, and then they will typically come back and do it again, right? So it's very common for them to see several months of relief, ongoing relief, and that's ongoing relief with no meds, no procedures, no additional therapies from you or anything. 3 to 6 months is pretty common. Come back later and do it again. And they'll do that year after year after year. They'll stay with you for years doing this. This will become probably the only way that they manage their chronic pain. There's so many patients that we work with where this has now become the thing that they do, right? They don't go back to meds. They don't want to go to narcotics. They don't want to go get in line for surgery or have invasive spinal procedures and get steroid injections. They don't want all that, right? When they start doing this is what they want. And because it's reimbursed and covered, they'll do it, right? So absolutely, regular cash pay patients are welcome, of course, like always. But that's what most of you out there as massage therapists know that's the standard is cash pay for all of these services. And our model being reimbursed is a huge asset, and that's what really builds the clientele for you, right? So being reimbursed, that also makes it a referable service. So you'll find most of these medical offices near you, they may refer people already in different scenarios for chronic pain and such, but if you've got something that's a reimbursable program for chronic pain, like this, that's non-surgical, non-pharmaceutical, non-invasive, yeah, they'll refer. So not only do the patients and the clients stay with you for a long time, but the offices around you have a very strong incentive to refer patients and for treatment, because it's covered and because they have typically no other options for patients. Like there's almost nothing they can offer. If they don't want to go to narcotics and the patient doesn't want to go do surgeries and all the invasive stuff, there's not much a primary care doctor or internal med doctor, there's not much they can do. They can recommend various things, but there's no other treatment they can really offer. If the current meds they're on stop working, or there's if the only next option is to go up to a certain level that just isn't going to work for the patient, or go to narcotics, and no one wants that, right? So I'm telling you, doctors will refer for this once they start to see it working. So that's something to kind of keep you motivated, and you'll see it, operate in our system. Okay, so getting to the business side of this, right? So you're an independent contractor. In our model, independent contractors, they are responsible for all their own equipment and supplies and expenses, right? That's why we try to pay as much as we can out of all of the reimbursements for everything. Try and make sure that everyone gets paid well, so it makes it worth doing this, right? You do need to purchase your own equipment. Some people in some scenarios we may be able to have the equipment provided in some scenarios, but I can't make promises to everyone. The equipment's so expensive that we can't provide it for everyone. And the groups we work with who do also provide equipment, they can't provide it for everyone. But in the normal equipment package for this is 30,000. For massage therapists, if you're not engaging the IV portion of that, we dropped that down to 28,000 because we have a $2,000 credit for IV supplies and such in the regular package for this. So in the scenario that you're only conducting the Neurassage technique, you're not doing any of the IV stuff. It's a $28,000 equipment package, and it is financeable. Most of our nurses and therapists do get this financed and get the payments down to around the 600 range. So we have several companies we work with who do financing for nurses and therapists like this. But if you were to get a patient on board, so people say, okay, let's assume that I move forward and I'm doing the financing for this equipment. $28,000 equipment package, financed with a company, and I got the payment down to $600 a month. How much can you make? Well, a single patient is going to average somewhere. I have a range because all the states are a little bit different. So let's call it a range between 100 and 140 or 120, whatever the state is. There's a few different states out there with pretty different ranges in there, but let's just call it 120 to be average, right? 100 and 120 is a good average point depending on the state you're in. A patient is going to do this with you for 2 treatments a week for 8 weeks. So that's 16 total events. Doing just some rough math on that, if it was even just 100, that's 1,600 right there. 120, I do the math on it. Sorry, I can't do it in my head while I'm talking here, but you can see where I'm going with this. It's, going to be closer to like $1,800 or so for that program. That's not including any tips or anything like that. That's just what we're paying you for the service. So one patient is enough to cover the cost of the equipment, right? So it's not the worst thing in the world to be able to cover your expenses for adding a whole new category of therapy to your service for really just one patient. So one patient worth of activity. Now, so how do you get patients? And this is the part that's exciting too. So with when the equipment package is purchased, when we can actually work with you on this, we can actually build up your area, and that's what we do. So we have an excellent marketing program. We are going to drive patients well, they come into our system because they're not going to your office. We have a mobile program, right? So you're going to treat patients where they are. They can absolutely come to an office if you have a physical office location and the patients are willing to come to you, totally fine. You work that out with a patient, but we're going to get a patient delivered into the system. They'll be booked onto your schedule for you. So that's how you know you have a patient. Our company does the lead generation and the marketing. We chase the leads until we get them ready for treatment, and then we book them right into your schedule for you. Okay. So most states out there, we have a service, a telemed service that will allow us to meet the patient for the first time and then get the patient telemed conducted right there on the site. You're with them, you meet them, meet and greet. Patient wants to do this program. You get the telemed right on your phone. It's a less than a minute wait to do this. 5 to 7 minutes on the phone with the provider. Provider signs orders for the patient. Patient moves forward with treatment right there that day, right? So that service is available for most states. There's a couple states out there where the service is not available, probably because the state has different compliance rules with how you do telemed stuff. We'll sort that out. When you see this post, if you're responding in, I'll reach out to you. I'll let you know which states are going to work or not work for that particular extra service. If you're in a state where we can't do that telemed service, same scenario applies. You're going to get a patient booked on your schedule, but we'll need to get a different provider to order treatment. Most of the time, the patient's current doctor will do it. It is a treatment that they need for chronic pain, and it's covered, right? So you and the patient can get the orders signed for treatment by their primary care doctor, or pretty much any other provider. It doesn't matter who the provider is, as long as they are a licensed medical provider in the state, they can order treatment for that patient, and you're good to go, right? So a lot of times patients know a few different doctors that they work with. So if one doesn't want to do it or whatnot, then another one usually will. We've been very good at overcoming the hurdles there for that. But ideally, if you're in a state where you can do the telemed service on site, that's the quick and easy way to get a patient into treatment. So you get scheduled with a patient, you meet them for the first time, do the treatment, they love it, they're out of pain, they want to keep going. You book them for the rest of the treatment on the schedule that works for you and the patient. So you are in charge of your schedule, and the only time we're putting someone on your schedule is for the very first visit. Very first visit, you get them, meet them, have a relationship, and you put them into your schedule wherever it works for you and for the patient. That's how you do that. All right. We pay out at the end of the month for all the services performed. So over the course of the month, you're doing all the work that you're doing, and then we pay out at the end of the month for everything that's been done. So that's how that works. The marketing side of this is pretty robust at the beginning, but you can only handle so many patients, right? I mean, you as a massage therapist already know this. You can't treat a million people, right? So our program is designed to be able to expand, right? We have people in our program are set up as independent contractors. That means you effectively are your own business. You're operating as your own business. And a lot of you out there are independent and do this already. When we start referring in patients, right, they can quickly overwhelm you. Doctors referring in patients can overwhelm you. Patient referrals coming from word of mouth, they can overwhelm you. So when you start getting more patients than you can handle, you can absolutely grow and expand. So you can hire someone and continue to accept more referrals. You bring that person on, they take over some of your load, your patient load, and you keep growing and growing. Some of our nurses around the country have multiple employees, and they continue to accept all the new referrals. Remember that the doctor who is sending you referrals every single week or month because they need they need the service for their patients, they're going to just keep on doing that. As long as you can take patients, they'll keep sending them. All your past patients, most of them are going to start coming back every, 2, 3, 4, 6 months, coming right back in, doing another course of treatment, taking up space on your schedule. So you got old patients coming back, got new ones being referred in. Almost everybody out there, once you get to a certain point, you either have to hire someone to expand or just put everybody on a wait list and make them wait. So you have options. You definitely don't have to hire and expand. It's not the ambition for everyone. But if you did want to do that, the world's open for you here. So you can hire people, you can grow, you can expand, you can go out and get your own referral, networks going. You can go to conferences and shows and things like that, and you can actually present and you can do all sorts of stuff to build and grow, right? In all that time, remember that being a reimbursable service and program is driving people in faster because they, when it's covered, they want to do it. It's a lot easier to get them into treatment. So that being said, that is the overall program, right? It may not be for everyone. The equipment package is a bit expensive, and I understand that. So not everyone can do it or will want to do it. But if you do, we'd love to have you. We are growing across the entire nation right now. We can take on someone almost anywhere in the country who wants to do this. There are certain states where this may not work compliantly with your massage therapy license. And we have a list of the states that will and won't allow us to operate this way with you specifically. But we'll work through that when you reach out to us. So after this video, reach back out to me. If I connected with you in one of the different categories and postings, things like that, and I put out an email to you or a message to you, reach back out to me. Let me know you want to move forward. My link's going to be in there. You can book a call on my calendar, and we'll get you moving forward. Great to meet you in the future. I'm looking forward to talking to you. And thanks for watching, and we'll talk to you soon. Thanks.